I had a great question come in from a subscriber that I would like to answer, and it was regarding Guyon's Canal syndrome and whether or not the video that I have for carpal tunnel syndrome would be effective. And the answer is yes. So let's do a quick anatomy lesson, which will actually go over carpal tunnel as well if you want a little refresher, and I'll try to explain how the two are related and how they are different. When you are looking at the forearm or the wrist with the palm up, you're going to see on this picture here, which I need to give credit to Musculoskeletal Key. This was the only picture that I could find that really showed everything, so they did a wonderful job on this visual. So you can see here in this picture, this does not have the bones, so keeping in mind that part of the carpal tunnel as well as the Guyon's tunnel has some bony areas that make up the tunnel, but it is not like fully enclosed in bone. So here there's a lot of ligament or retinaculum and fascial components, and that's the parts that we can manipulate. Like obviously if you have a bone that is out of place, that can cause nerve issues. I've had that happen. You go to the chiropractor, whatever, get that adjusted, and you're fine. But if you have true carpal tunnel or Guyon's syndrome, you're not going to just be able to go in and have an adjustment and everything get better. So what we can do is manipulate this fascia here in order to provide more space and free up more space for the nerves and less compression for the nerves. Again, you keep in mind that if this is a bony issue with arthritis, I think with Guyon's tunnel, there can be actually like a part of the bone that breaks off. They could be in the way. This type of stuff isn't going to help with that. But if it is an issue of tightness and that fascia is pulled tightly across, then we can manipulate that, open that space up, and allow there to be, at least on one side, it's not compressed, on both and all around, that we can free up an area that just lets there be a little more space in there. That is what we're trying to do with the fascial release work in the video for the carpal tunnel. I hope that helps. So head over to my community page. Just now set it up. Just now realized it even existed. So I'm still a few years behind on all of this stuff. So let's have some fun with it.